Hi, everyone, and welcome to another episode of the Pelvic Health and Fitness Podcast. Today, I am honored to welcome my friend and colleague, Danielle Ufniak. Danielle is the founder of Flow Physio Wellness, a multidisciplinary clinic that includes physiotherapy, chiropractic care, massage therapy, pediatric care, Pilates yoga, and most relevant, women's pelvic health. Danielle is a registered physiotherapist, pelvic floor physiotherapist, certified perinatal fitness coach, certified mat and reformer Pilates instructor, and most recently, a mother to almost 2 children. She is currently 31 weeks pregnant with number 2. Congratulations.
Thank
And
you.
if that wasn't enough, and the author of the book, Empowered Mama. You are up to a lot of things, Danielle. So impressive.
I know, I'm a forever student.
Yes. Danielle's mission is to help women feel empowered and confident while moving through the many transformational periods of their lives, periods, pregnancy, postpartum, and beyond. Thank you so much for joining me today, Danielle.
Thanks for having me. I'm so excited to chat with you.
Yeah. So we got your bio there. Again, you're up to a lot of things, but do you want to just give our listeners just a little bit more background about you and what got you into the field of pelvic health physiotherapy?
Yeah, definitely. So, I graduated from physiotherapy school and I went right into working in a gym setting. I've only ever worked in gym settings, as a physio. So working with a lot of athletes, and I would say a 50-50 split of like male and female athletes. And there was definitely some gaps in my knowledge, specifically coming to female athletes, specifically around pregnancy and postpartum, and then also with some symptoms that they were mentioning. So that definitely got me into exploring pelvic health, as well as I was a marathon runner and I would pee like every race. So
Dang.
once I learned that that was not normal, because it was something we did joke about at the time, black tights only. Um, and so out of like personal interest plus working with this population in gym settings, I got into pelvic health. And then during COVID, when I became pregnant with my own daughter, I was like, oh, now I still have gaps in my knowledge within pelvic health, specifically in pregnancy and postpartum fitness and athleticism. So that's when I pursued doing that certification through Brianna Battle's course, which is how we got connected. And yeah, and it's really changed the trajectory of how I approach pelvic health and women's health too. So it's been nice to marry the two.
So cool. Yeah, we have that a lot in common in that regard, just in the sense of working out of a gym. I feel like that in and of itself is a more rare thing, right? Like I think it's becoming more common, but definitely not the norm. Did you start your business right out of school then?
Um, I worked for a business for about a year. And then when I did my pelvic health cert, that's when I went out on my own.
Gotcha.
I just started small, like renting a space from another brick and mortar clinic, but I really did go out on my own because at the time, this was 2015. The clinic within the gym that I was working for, like, didn't understand that like pelvic floor physio, you need like a windowless room.
Yeah.
You can't have people clanging weights next door. So it really like kind of gave me that push to into this entrepreneur space as well. Because I knew I had a vision in my mind of what I wanted it to look like. And it was like very niche.
Yeah, amazing. So do you want to just tell our listeners a little bit about what your business is Flow Physio and Wellness.
Yes.
What it looks like. How did you set it up to sort of marry all of those passions that you have?
Yeah, so it started out as just me. And I chose the name Flow because of the theory of flow state. So it's the theory of it's by this I don't know, I guess philosopher Csikszentmihalyi, where you enter a state where time passes without you even knowing, things feel effortless and it's your happy place. And so especially working with athletes and really movement being a pillar of my business, I want people to help them find their flow state in whatever it is they love to do. So that's where the name came from, and it was just me. And then I met my now husband, David, who was in chiropractic school at the time. And so when he graduated, he came on. And it was just the two of us for a few years. And then during COVID, we opened our own brick and mortar and we brought on more team members. And it was funny, like with everyone we've brought on, it's been like kind of law of attraction where they've reached out to us and have said like, we like what you're doing and we very much align with you. So it's been easy to build because like it's been people that are already in our space and have our values and like very similar professions or niche of patient like caseload. So
that's amazing. Cool. And that's what's so wonderful about social media. You know, we connected via social media. Yeah, you can just be, you know, putting your message out there, putting your values out there. And that's a wonderful way to get employees, right? Versus trying to just put a random ad out there and just hope for the best that they're going to align with you, right? That's amazing to just attract those people that way.
Yeah. It felt organic. It felt authentic to the business. And I think because it's multidisciplinary, when people come in and they see one or more of us, it feels very much like everyone's on the same page, which my core values around physio and women's health are very strong. And so like, I definitely need a team to use that same language and reflect those same goals if they're going to work with me.
Dang, that sounds such a beautiful environment that you've created, Danielle. Very cool.
Thanks.
So do you want to just share with us a little bit more about your story with your pregnancy? So you're right in the middle of your second pregnancy now. What were some things, you know, you have this background, this knowledge. What were some things that still surprised you or, you know, lessons you had to learn in regards to exercise during your pregnancies and are probably still learning?
Yeah, still learning for sure. Yes, my first one, I think that's why I'm finding this pregnancy like much more liberating. I'm finding it much more enjoyable because a lot of the things in my first pregnancy, like I had the pelvic health information. I think a few differences were my like feeling need of being in control was really hard for me to give up.
Yeah.
I'm very type A, and that feeling out of control doesn't sit well with me. And a lot of women that I speak to kind of like resonate with that as well. And not knowing what's to come is also super scary.
For sure.
So that is was like a big theme. Also creating boundaries, um, boundaries around work, boundaries around how I use my limited and still being limited energy supply, adaptability, because something that I really do hit home with women is that things change week to week, and not kind of experiencing a change and then spiraling and being like, it's only going to get worse from here. Kind of seeing it as more of this like ebb and flow, than like a kind of like the linear trajectory in terms of everything, in terms of performance, symptoms, energy, mood, everything. So I think those were the biggest things that prepared me for this pregnancy. The first one, I also had a big problem letting go of ego and comparison, which Brianna talks a lot about in her course. And now I've implemented a lot in my treatment, especially with social media and comparison being so readily available online. That is something that I've had to really do some self-work on.
Amazing. So yeah, this time around, do you find you're able to sort of like scale back a little easier, modify a little easier versus your first pregnancy?
Yes.
Yeah.
I've definitely been more gentle with myself is how I would describe it. Also just listening to my body. So before becoming pregnant with my daughter, Lennon, I was doing CrossFit and I thought, oh, well, I have to continue doing CrossFit because things can't change ever. Whereas this one I was doing strength training and Pilates and running before. And then once my pregnancy came, running is really the only thing that has felt good in my body and that my body has liked doing. So I've kind of just gone with that, and I've given up the other things without guilt. And I think that's a big part of it too, is like not feeling guilty. Also, I'm proud to say I have not weighed myself once this pregnancy, whereas last pregnancy, I weighed myself every single day. I could tell you exactly to the pound how much weight I gained from beginning to end, which is
Wow.
kind of sad.
Yeah, I relate, Danielle.
Yeah, like there's so much more to it than that. And so I'm really proud of myself for that as well.
Good for you. Yeah, that's amazing. I know I wish I could go back in time and learn all these lessons before. I came to this world after my two kids, more because I
Mm,
had a challenging postpartum recovery.
yeah.
My pregnancies, I knew enough to scale back, but definitely could have done a better job of being kind to myself, like you said. And yeah, for sure, tried to, have the belly only pregnancy, which is like, what does that even mean? We can't control that.
Yeah.
And for sure, like weighed myself. And now where I'm at, like if I were, I'm not having any more kiddos, but if I were, my experience would be 100% different.
Mhm.
So in terms of body image, did you do anything to sort of heal that side of yourself, to let go of maybe those ideas of, yeah, only gaining a certain amount of weight? How did you get to this point with your second pregnancy?
I think after going through pregnancy and postpartum the first time and realizing how much of a blip that season truly is in the grand scheme of things, like not getting hung up on it. It's easy not to get hung up on it once you're on the other side and you see like, oh, okay, I'm 12 months now postpartum, and my world and my body feels so different than 12 months ago, and 12 months is nothing over the course
Right.
of a lifetime. And so really reminding myself that this is a season, this season will end, so you might as well enjoy it when you can. And I knowing that this is my last pregnancy as well has really helped with that, because I'm like, nope, stop with the negativity, sit in this and enjoy it, be present, take it for what it is, learn from it, and then get ready for the next season. So,
Amazing. Such a
yeah.
great outlook. How was your postpartum experience with your first?
I was very lucky. It was very good. Physically, I would say mentally it was tough because it was still COVID. I probably should have talked to someone, like more of like on the mental health side of things with, postpartum. Like specifically, I err on the side of anxiety, and now having more people in my network that do perinatal mental wellness, and for some warning signs that they've told me, I'm like, oh, yep, I should have talked to someone. So this time more open to that, and just more aware of what to look out for. Physically, it was good. And I do think that I was very gentle with myself physically postpartum, because I have seen the effects of jumping into things too quickly, and how hard it is to undo some of those compensations and strategies once you start using them. So I think that was something that I was like very aware of, and still am. So
Good for
yeah.
you. Awesome. So the reason I reached out to you to record today is you have been posting sort of openly on Instagram with your pregnancy journey, with exercise. I just love some of the messages you're putting out there. One of the things we learned in Brianna Battle's course is the pendulum swing that exists with exercise, right? So, back in the day, the joke in the course is like our grandmas weren't doing CrossFit, right? So messaging back then would have been, go swimming, just take it easy, do yoga, which is an interesting statement because yoga is not a benign activity either.
Yeah.
Walking, right? And then the pendulum kind of swung the opposite way with, yeah, CrossFit and like you're hardcore, just keep doing what you've always done. And where, I think what Brianna Battle's course does well and what we as coaches try to do is find sort of like that messy middle for people.
Mhm.
So let's talk a little bit about just like some of the myths that still exist. There's still a lot of misinformation and just mixed information for pregnant folks in regards to exercise. The first one that comes to mind for me, and if you want to talk through this, is Kegels, right? So
Oh
I feel
my
like Kegels has had like, everyone knows what Kegels are now. Most people do.
Mhm. I also hate
And
that it was named after a man. Like,
right.
come on. I
Yes.
refuse to use that term in my practice. I'm like,
Do
no,
you?
It's a pelvic
pelvic
floor
floor
muscle
contraction.
contraction. Yeah, I'll
Yes.
say the whole mouthful.
Good for you. Good for you. Yeah. So I feel like, everyone learned about Kegels. Everyone almost was taught like you're going to Kegel all the time, just Kegel, Kegel, Kegel 100 times a day. And
Mhm.
then, now some of the messaging you see online is like, Kegels are bad for you. Kegels are going to make your symptoms worse. And I think, again, like anything, let's find that
Mhm.
messy middle. So do you want to just talk us through Kegels during pregnancy?
Yeah. So normally I encourage women to come in first trimester. I've actually heard of some pelvic floor physios that will refuse to treat in first trimester, but I think it's such a scary time and such a great time to slip in some of this information and education and bust some myths like before things start changing. So with Kegels is something we address day one, and how I approach it is I say like, we don't ever want to learn just one thing. We want to learn to use our body in all the ways. So you definitely want to be able to do a contraction, but we also then need to be able to learn how to relax. And it's more about coordination than gaining strength in pregnancy. I want you to be coordinated as a pregnant woman and not just like trying to get as strong as possible. And if we think about any of the muscles in our body, most of the muscles in our body, they work in a contract relax setting. There's very few that work isometrically or work well isometrically. And so I really do show people in my own body with my own muscles, like what that would present like. And once they see that, they understand the importance of being able to do both sides of that pendulum. Find your contraction, but then be able to let it go, and everywhere in between. And we also talk a lot about tension to task, which is something that Brianna talks about in her course. But I really like the analogy of like, it's not a light switch, it's not a grip or a full like release. Like you can use it as a dial too. And you find as much support in your pelvic floor muscles as you need for whatever it is that you're doing and however challenging that thing is. So yeah, that's how I educate on it. And then how I implement it in practice is I don't ever prescribe Kegels ever. I educate women how it's naturally part of the movements we're going to be doing and what they're already doing in their daily lives as well.
Yeah.
And so it's not about adding exercises or adding Kegels in bed every night. It's about becoming more intentional and aware of when your pelvic floor is doing those things. When is it contracting? When is it relaxing? Even being intentional, like, and mindful of like, oh, I just coughed and I didn't leak, so my pelvic floor must have contracted. Or I went pee and it was effortless, so my pelvic floor must have been relaxed. So just like kind of showing them the situations needed for both, and incorporating it into some of the exercise we do together.
Amazing. That's beautiful. And I think the other sort of myth that exists out there, and this is something I sort of considered or thought about before I knew about pelvic floor, before I learned this world. I was doing CrossFit when I was pregnant, and I sort of thought to myself, and the message I heard was, yeah, you want a strong pelvic floor to push your baby out, right? Like you want a strong core, you want, right? I think that's such a common myth too. And it makes sense, right? If you think of it sort of physically, where like, yeah, you want that strong contraction to push baby out. Do you want to just touch on that about how that's not entirely true?
Yeah, in fact, it's like completely the opposite.
Right.
So yes, so pelvic floor muscles there is a series of them that are sphincteric in nature, meaning that they close like a sphincter or relax. And we actually need them to be completely relaxed to have as minimal barrier to kind of entry or exit for pushing baby out. The muscles we actually want to train would be our transverse abdominis to create more intra-abdominal pressure to then push baby down and out. And then the other big muscle group is the uterus, which you don't have a ton of control over. And then breathing, using our breathing and our bracing with our transverse abdominis muscles and that pressure management to have an effective push. But I also have been lately educating on like intensity of push. I really feel like we overemphasize like this really powerful 100% push, where our pelvic floor muscles like a little bit of a warm-up period. They don't want a baby rocketing through them. So like really training for this, like, this 5 minutes of pushing, that's it, like a race type of situation, I find is can be really harmful for your tissues.
Yeah.
So telling them it's not a race, and like explaining the pelvic floor needs to feel relaxed. I still do some perennial retraining and some pelvic floor muscle. I don't call it like perennial massage because we're not massaging, but pelvic floor relaxation training closer to birth as well with my patients. Yeah.
Amazing. Yeah, thank you for that. So the other thing I wanted to touch on myth wise, if a client, so many people, myself included, experience nauseousness and just not feeling great during the first trimester, and maybe just don't have it in them to exercise, right? And again, if I were to do it again, I would have been much more gentler with myself, but I still forced myself to try to work out during that time. But if folks maybe are not feeling it and they just would rather rest or stretch or whatever that might be, and then they might have been told, like during pregnancy, it's safe to continue doing things that you've always been doing, right? Like running, maybe, for example.
Mm.
But say someone has that fear. Well, I didn't run that entire 3 months of my first trimester. Maybe now it's not safe to start running again. Do you want to talk about that?
Yeah, that is just 100% a myth.
Yeah.
So, there used to be a lot of medical professionals that would say, oh, if you weren't working out prior to pregnancy, or, you took a big break, not a good time to reintroduce movement into your pregnancy. Or, if you were, a runner, or you were doing CrossFit before, like, don't introduce a new style of movement or a new type of fitness. And I think that's so detrimental and like already pigeonholes you so much. From personal experience, I did nothing in either of my first trimesters. And the second trimester, a switch just went off and I said, I'm good to go. Let's do this. And I kind of jumped back. Well, I didn't jump back in. I waded back in.
Yeah.
But I think when they're in that moment of feeling crappy, just reminding them, like, again, a very small season of pregnancy of the whole overall journey, and you can reintroduce this like this movement that you want to do in second trimester. And if that movement doesn't feel good, we can try anything else. So and that's why I pursued Pilates, because my background is strength training and running specifically. But I found for patients that maybe came from either of those backgrounds, but then were like, no, this is still not working for me. Maybe like I feel better, but these aren't working. It's nice to have like a third kind of facet of movement that they can experiment with me. So I think you don't even need to stay in your like wheelhouse or your pre-pregnancy kind of like movement identifier. It's a nice time to explore other movements and use some of the strategies that you're working on with the breathing and the bracing and being intentional with core and pelvic floor, and apply them to these new movements and have even better form doing it.
I love that. Just thinking of it differently, that, it's a great time to just explore different ways to move.
Mhm.
One of our mentors, Anthony Lowe, always talks about move all the ways, right? So it gives you
Yeah.
a chance to just, try things and just see how it feels. And what a great skill then for someone to have as they move into postpartum, right? And just
Mhm.
teaching them that all movement counts is, something I talk about all the time. All movement counts. It all counts as a workout because you're honoring where your body's at. You're meeting it where it's at. You are moving in a way that's going to honor, your long-term health. So like check, 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 right? So that's a
Yeah.
great time to do that. I love that.
Yeah.
Cool. So what are some recommendations or considerations that you talk to your clients about in each trimester when it comes to exercise? Again, I know there's a lot of myths out there of like, don't lift over a certain amount of weight, or, don't do certain things in your first trimester, last trimester? What are some things that you talk about?
Yeah. So in first trimester, we really hit home about like, okay, here is what's going to happen inside of your body. I like to do a ton of anatomy and education prep work so that they can very much visualize what is happening in their body, because it makes them better intuitive movers of what they'll probably have to change, right? Once they understand how everything works together. So we front load it with a lot of that. And we talk a lot about how it's normal to not be able to move at all in your first trimester, and to really prioritize hydration, to just like, even if you're quite sedentary, which is fine, but still lots of position changes, because the human body doesn't like to be in one position for too long, even if you have a desk job, right? We want to switch things up. So we talk about that. And then we talk about like working on some strategies, like maybe you're not running, maybe you're not strength training, but while you're sitting at your desk, can you do a few core breaths for me? Right. So like, can we get these little movement snacks in, or these little kind of training snacks in, so that when you do feel better, or if you do, you can then use those almost like little accessory prep things that we did, and then apply them to your big movements again. So that's what we do in like first trimester. And then the beginning is second. Once they start feeling better, that's the time I get into like a lot of myth busting. Specifically, I find the biggest questions for me are around heart rate, and breathing, around core exercise, and around impact. I would say those are like the big three that we really hone in on for a second trimester, because that's when women's bodies are changing and they start getting very concerned about those three things.
Do you want to just get a little deeper into that then? Let's start with like heart
Yeah.
rate. What do you talk about with heart rate?
Yeah. So, okay, for example, myself with this pregnancy, I have loved running. It's just
Yeah.
felt really good. And it horrifies some people to see me out there. And so with heart rate, I give women that like kind of freedom away from tracking it,
Yeah.
because I think it is so detrimental to their fitness. So there was a study done, I think it was in the 80s, that said like, don't go over 140, and nothing since, really. Nothing that I've found since. So not great. I tell women like, obviously we don't want to be in our like max heart rate zone. So find your max 220 minus your age. Like, you don't want to be in that 80 to 100% of your max for, for longer than probably 30 minutes. And truly that would be something that's really hard to do even like before pregnancy. And with the structural changes that occur, like you're not even physically going to be able to hit that probably. So that's kind of like a window that I give them, but I more so like RPE, which is rate of perceived exertion. Or my favorite thing that I probably say 1,000 times a week in clinic is, you can be breathy but not breathless.
Love that.
So in terms of that, how I describe it is like, if you and I were going for a run side by side, maybe we're not talking because we are really focusing on our breathing, and we should be. But if we were to stop, you wouldn't need to and collect yourself for a minute, before saying a sentence to me. We should be able to stop, and then you turn to me and say a sentence. That's kind of the outline I give women. And some women love that kind of freedom to then explore and push themselves. Some women do like the 140, and they have to do whatever works for them and their comfortability in their pregnancy. And that's not for me to decide, but I do like to give them all that education about like where these numbers are coming from and other strategies they can use for aerobic exercise.
Amazing. Like informed consent, right? We talk about that as physio
Yeah.
all the time, right? Just giving people options. Cause I think again, we have grown up in, generations where it's these very hard and fast rules with maybe not a lot of context, or studies that back in the day that maybe aren't holding true today. So just
Yeah.
giving that wide array of information. You can do this, you can do this, you can do this, and then what feels right for you. I love that.
Mhm.
Yeah,
Yeah. Yeah.
amazing. So the next one you mentioned was impact. So what do you talk about clients with that? So like skipping, running, box jumps, those types of exercises, those types of movements. How do you discuss that during pregnancy?
Yeah. So again, I think giving them a lot more freedom than they feel like they have. And some of them what may have been told by their medical professional, like their OB or whoever their care provider is, like to avoid it. But um I can assess that much easier than they can in their office. I can watch them do a box jump. I can watch them run. And so I think it should be up for more of like a conversation between me and the pregnant person than in their office, they're on their back, they have no clothes on, right? So what we talk about impact is we want to be symptom free, obviously. So I do a lot of education again on like, here are symptoms that your pelvic floor, your core, your body is not coping well with this movement anymore. And we go over all those symptoms. And like some of those symptoms include, pelvic pain. Are you leaking? Do you feel heavy? Are you having to like hold your breath and really grip everything to do this movement? Do you have back pain? Do you have hip pain? Do you have pelvic girdle pain when you do it? And with impact and with core too, sometimes I get them to show me like their absolute max effort and then do something a little more controlled while I'm cueing them so they can see and feel the difference between the two, because they'll be like, oh yeah, this one that I just went balls to the wall, that felt yucky compared to when you cued me a little bit. And then it kind of gives them that that intuitive athlete, like getting a sense of what truly does feel good. And then my only concern with impact is it's safe. So for me, doing burpee box jumps on a good non-pregnant day is not even a safe activity. I failed so many times. So as a pregnant athlete, I don't consider that safe. I consider that way too risky. So I don't do that. But for someone else, they might feel very proficient in it and super confident and like they're agile more and more coordinated than me. They might continue to do that throughout pregnancy. So again, it is such an individual experience. And I really try to reiterate that. And I like to say like, that's where we're at this week, but like next week you have to reevaluate. And the week after you'll have to reevaluate because things change so frequently during pregnancy.
And I think that, gets probably into a whole deeper conversation that you and I went through ourselves of that identity piece and identifying with yourself as an athlete. And I think a lot of people struggle to let that go during pregnancy, right? So something like a burpee box jump, it's like if I, can't do it or if I take that off the table, then I'm not the athlete I once was. Where, just reminding folks that it is a temporary time. It doesn't define you as an athlete if you have to modify certain things. But I think that's the struggle, right? For a lot of folks that are just so tied to that athletic identity and just
Hmm.
can't seem to let those things go during pregnancy.
Yeah. Yeah.
Yeah.
But you have to circle back to that like risk versus reward, right? Like, is the risk of this movement or the symptoms that you might be feeling like worth it? We also have to like always circle back to like, what will this do for my postpartum healing and recovery? So, and I think putting that in perspective for some of those more like steadfast athletes, it does help. Like I say, I kind of reframe it like, okay, we'll take this out now because that will really help you postpartum return to, what you do love to do. So it's a risk for, and again, they have to make that decision for themselves, but I'm here to help kind of guide it
For sure.
or educate. Yeah.
Yeah. Bodily autonomy, but again, giving that full picture, that full spectrum view with the education that we have, right? Because a lot of people myself included, I didn't know a lot of these pelvic floor things when I was pregnant, even as a physiotherapist.
Yeah.
So perhaps had someone said, doing some of these things now may potentially impact your pelvic floor down the road. Maybe I wouldn't have changed. Maybe I would. Who knows? Right.
Mhm,
But
mhm.
give that information, and then bodily autonomy. People can choose what they want to do, but at least they have that guidance. They have that info.
Yes. Yeah.
Yeah. And then the last one, I'm curious to talk more about this with you because, again, I think this is something you shared in your posts with core exercise, right? So I think that is sort of that gray area where people feel confused as well. Like, should I stop all core? Can I do some core? What core is safe? What's unsafe? Can you talk to us a little bit about that during pregnancy?
Yeah. So I guess my overall arching message of pregnancy is please do core throughout. Um, because I really think it comes within the context of like what is our core? Because I'm not talking about your six pack. I'm not talking about crunches. I'm talking about this whole trunk canister and making sure that that whole unit of muscles is working cohesively together. And truthfully, every exercise becomes a core exercise when you're pregnant,
Yeah.
especially when you get into second, third trimester. And when I say training core, I'm talking about movements that involve like full body stability, that involve breathing cueing at specific times, and involve some type of like coordination or control aspect as well of our trunk, which is like how I picture the body in my practice is like a can with like arms and legs coming off of it and a head. And so when I say core, I'm talking about that whole can. So it is kind of hard not to train your core during pregnancy, but I think a lot of the body changes and a lot of the common symptoms I see, low back pain, hip pain, pelvic girdle pain, could be readily addressed if we train core throughout. So that's kind of my overarching theme. And then within that, people are very wary of lying on their back to do core. There is this extreme fear of diastasis that I see that still persists, and a lot of not feeling confident in making exercise decisions for themselves. Those are kind of the three big things that I see pregnant women struggle with when they come into clinic.
Yeah. Yeah. So interesting. I think just reframing what is core exercise. I think educating people like you just started out with about what actually is your core. Again, even as a physiotherapist, like learning about that core canister, I'm like, oh, I don't remember
Yeah.
that in school. Like this is brand new information.
Yeah.
And
Yeah.
so, yeah, educating clients that like a front squat is a core exercise. Like I talk about that all the time, right? And just like you said, coordinating your breath is going to engage those muscles in a way to do what we need to do to keep that core strong, coordinated, whatever that goal might be, right? So I love that answer. And so I think this is where it would be helpful for folks that are listening that are like, well, thank you, Danielle, for this information, but I'm still confused. Like what is the logistics of like, what can I do? What can I not do? But working with a pelvic floor physiotherapist, working with a postpartum fitness coach is that guidance, is that encouragement to, go through the things that feel good for you, give you that individualized approach. I think that's sort of the missing piece that a lot of folks don't know exists, right?
Yeah. Yeah. I have women come in that have had fairly straightforward pregnancies, no real issues or symptoms to address in clinic, but they would like for me to have eyes on them, watch them do some of these core movements and just give them that reassurance that, yeah, things look great. Or try this or breathe at this time. And also showing them like what is their diastasis, how to find it, how to feel it, getting comfortable with it. Like truthfully, my first pregnancy, I didn't even want to like feel my belly really like during exercise, and really like being in tune with it and feeling it and having your hands on it when you're doing some of these movements can be so helpful to create this body education and body awareness, to help you make your own decisions as a pregnant athlete. So we do a lot of that together too, and a lot of myth busting.
I think, like you said, just giving that permission that maybe, people don't realize that they need to try things, right? Even
Mm,
during pregnancy, I think many of us have this fear that, yeah, like, oh, if I jump or if I skip, I'm going to ruin my pelvic floor forever. And that's just not true. Our body is much more resilient than that, right? And so even a core movement, someone might say like, oh, I was told I can't do a plank. Let's try it. Try a
yeah,
plank. Let's see how it looks. Let's see how it feels.
yeah,
If it
yeah,
feels okay, again, you're not going to cause a diastasis. Like diastasis is a naturally
yes,
occurring event in the body to make room for baby. It's not going to rip your abs apart like many of us were led to believe, right?
yeah,
And so if you do that plank and maybe it doesn't feel great, okay, we tried it. Let's modify, right? It's
yeah.
giving people that permission and that removing that fear. You're not going to do irreversible damage by trying something.
Yes, yes. And I'm still teaching a weekly Pilates class, and I preface every class with, hey, I'm gonna try and demo these movements to the best of my abilities. But if I get up and I start just walking and telling you what to do, it's because I no longer can. So I'm still week after week, I'll try something and be like, nope, nope, can't do that anymore. And it's a good like learning experience, and it makes me feel more confident in my ability to know my own body. And I really encourage that in my pregnant, and you know what, in all my patients, because even in my Pilates class, I'll cue a movement and people will look at me like, I can't do that. And I say, just try. Let's see
Yeah.
what it looks like. So these are strategies and habits and, I guess, thought beliefs that are helpful for pregnancy, but make us better athletes for life. I think this permission to try and know our own bodies.
Yeah. And that can transfer just into regular life too, right?
Mm.
Someone might be nervous to pick something up at the grocery store, right? But it's like if you are learning these things and you practice these things in the gym, it's going to transfer into everyday life to give you that confidence that, oh, I am so much stronger than I ever thought I was. And I know you love doing that, Danielle. That's what I love doing, just empowering people, making them realize that, yeah, again, they're so much stronger than they thought they were.
Yes, totally. Yeah. Empowerment, education, movement, those are like our pillars. Like, I love when a patient doesn't feel like they need me anymore. And that's truly empowerment, like giving them those tools and that education and that knowing themselves so that they can go out in the world and like live their life to their fullest potential.
Love that. So we touched on a lot of amazing things. I think this is going to be such helpful information for people. Is there sort of like a take home message, last little tidbit of advice that you want to leave our listeners with today that you didn't touch on already?
I guess, well, I think a big part of prenatal pelvic floor physio and prenatal fitness is I don't think it gets as much recognition as postpartum. On social media, in the women's health space, I think postpartum is what women really dwell about. And I think there is a mentality of like, let me just get through this pregnancy and I'm going to deal with my body after. And I don't think we need to live that way. I think there should be more care during that prenatal period. I still have women come in postpartum and say, I didn't know I could see a pelvic floor physio during pregnancy. And that to me is sad because they could have maybe had a much more enjoyable experience or a much more positive experience or felt a lot more like self-efficacy and like autonomy than it, especially surrounding labor and birth. And so I guess my take home would be that prenatal fitness and prenatal pelvic floor physio are just as important as postpartum. And it should be the start of this journey in knowing yourself is the beginning of pregnancy. Don't wait till postpartum. Don't wait to just fix your body after. Let's work on it throughout. Let's build good habits and a good foundation now to serve you for postpartum. Yeah.
Beautiful. So well said. All right. So thank you so much for joining us today, Danielle. Do you want to just leave our listeners with how they can reach out to you, how they can work with you? So yeah, I'd love to hear some contact info, and then tell us just a little bit more about your book too.
Yeah. So people can find me at our website. It's just flow-wellness.ca. And it has all the fun things that are going on in our clinic and any workshops and the run club I run here in Bowmanville, and all of that. I also have some freebie PDFs on there. I have a postpartum ramp up program on there. It's 8 weeks and it kind of takes you from that like medical clearance back to the gym or studio of your choosing. So it's very much that like weird gray zone, I call it. So I have that on there. And they can also find me on Instagram. It's Flow Physio Wellness. I am going to be off soon, so I will not be taking new patients, but I have a wonderful team, and I'll shout out my husband, David. He is a prenatal chiropractor, prenatal infant chiropractor. So we're so lucky to have him too. He's going to be running the show when I'm off. And then, yeah, my book, Empowered Mama. So it is a prenatal pelvic health guide and journal for pregnancy. And so why I created it was journaling was very important to me during my last pregnancy because, again, of the anxiety that I was experiencing. It felt really good to just like put it on paper, and then it felt less scary and daunting. And I actually went back and read my journal for my first pregnancy, and some of my thoughts and beliefs, I was like, whoa, that's wild. So it's been really nice this time to be able to look back and read through it, and like almost reassuring in a way of like how much better I'm doing now.
Well,
So that's why there's the journal component, and like almost more of like this get it on paper, get it out of your brain component, because for me that was super important. And I've also included a lot of prompts from specialists in the field like yourself, just talking about some of those common themes that come up in pregnancy. And so putting tidbits from experts in all parts of prenatal health. So we have naturopaths, we have fitness coaches, we have physios, we have doulas, and more. And so I like that side of it to kind of get a more holistic look. And then the pelvic health guide part is mindfulness and exercise recommendations and general information divided into each trimester. So making it more bite-sized chunks than, you know, being inundated with all of the pregnancy information at once, because I also think that's very overwhelming for people. So I've kind of married the two. Here's the education. Now let's reflect on it. And then education, reflect, and all the way through to 4th trimester.
oh,
Yeah.
amazing. And yeah, I have a copy myself, Danielle. It's so beautiful, so well laid out. I honestly, as I'm flipping through it, I'm like, I wish I had this during my pregnancy. It's just, I also love journaling and just would have been such a great resource. So I'm going to put all of that in the show notes. So if folks are listening and thinking, oh, I need to get that, they can find that in the show notes.
Awesome. Thank you.
Yeah. Thank you so much for joining us today, Danielle. Such a great conversation. And again, such helpful information for people.
Yeah, thanks for having me. It was so great to chat with you.